You know the bacteria, you know the test, but you'll be still scoring low marks because you don't know how to write it in the answer sheet. In the next few minutes, I will show you a general scheme of how you can write a bacterial diagnosis and score high marks. First and foremost, read the question given to you properly. Read on what are the presenting symptoms of the patient, duration, what are the associated signs and symptoms, and what are the physical examination findings to come to a provisional diagnosis. For example, say low-grade fever happening in the evenings is most probably a tuberculosis patient. Then you decide on the sample, what sample you want to collect for that particular infection. Some things you have to keep in mind and write are what is the timing of the collection of that sample, what type of sample, and always write that sample should be taken before giving any kind of antibiotics. What are things are required for the sample collection, and most important is following the aseptic technique. Once the sample is collected, comes the first step in the lab, which is direct demonstration. That is your microscopy. Write relevant microscopy. It may be gram stain, or if you are looking for tubercle bacilli, it's acid fast staining. If it is a stool sample looking for Vibrio cholerae, then a wet mount or dark field, or these the direct demonstration techniques will help you give the report earlier. So mention them definitely. Once that is done, write about the type of culture media. It can be a non-selective media, or if your bacteria what you're writing has a selective media, mention that. Enriched media also you can mention for certain samples. Then mention the incubation conditions. So that is 37 degrees overnight for most of your bacteria what you are going to write. So after that particular incubation time is over, what all will you look for in your culture plates on the first day? So what is the shape of the colonies formed, how many colonies, whether there's hemolysis, whether there's any kind of a pigmentation or any particular order, mention that. After the bacteria has grown on your culture plate, you will write about the biochemical test. So for gram-positive bacteria, it can be a simple coagulase test and the catalase test. For gram-negatives, all you set up biochemicals. You have the IMBIC reactions, you have the indole, methyl red, BP test, citrate, urease, TSI, all those things are your tests you are supposed to mention without fail. After this, we'll talk about the antibiotic susceptibility testing. The most common test what is done is a Kirby disk diffusion method, because it's simple. The technique is very simple. You don't need too much of a experience to do that, and it is cost effective also. Always mention about the MIC. There can be a broth dilution, or it can also do a Agar dilution also. The simpler version of that is to do a E-test. Then when some organisms are difficult to isolate, or you want to see whether it is the same organism which is causing the infection, you can do antigen antibody testing. All those things will be the serology part of it. For example, you can write about Widal if it is a typhoid test. If it is considering syphilis, you can write about VDRL, or if you are considering about the streptococcal infection, you can write about ASO. Like that, you can, depending on your bacteria, what you are thinking in mind, you can write about the serology. Next comes the automated methods, which is your maldi-tof for identifying the bacteria, Vitek for identifying the antibiotic sensitivity pattern, or any other automated methods which are specifically mentioned for that particular bacterium. Then PCR for looking at the resistance profile. Obviously, you will have the resistance profile in your antibiotic sensitivity testing itself, but more specific is your PCR or other nucleic acid test you can use for this particular bacteria. So general scheme, if you want to see, you will look about, first of all, you have a clinical suspicion, then you have a proper sample collection, then you have a direct demonstration by microscopy, then culture, then biochemicals, then you will talk about the antibiotic susceptibility testing, your serology and molecular methods, and finally give your result. So this is basically a general scheme of the laboratory diagnosis of bacterial infections. Thank you for watching this video. Please do like and share my video and subscribe to my channel for more content. I've also made a small shorts for the same, so that you don't have to spend even 5 minutes. You can just finish off in 1 or 2 minutes. So this link will also be provided in the description. Thank you.